Hello, my name is Dr. Julian Silva. I'm a London-based facial, cosmetic and plastic surgeon, and today I'm answering a commonly asked question about facelift and neck lift surgery. Why undergo a facelift or neck lift? And in answering this question, well, we're really going to cover three aspects to it. Why undergo this kind of procedure? What will be the benefits of the procedure? What can be achieved? And how can it be done? And so, well, first of all, what we need to do is have a look at what happens with facial aging. And in a way, there's three common aspects that will happen to all of us with natural aging. One is volume loss, and we all tend to lose some volume, and that is one of the reasons why non-surgical treatments such as fillers has become so powerful, because you can add volume without undergoing surgery. Secondly, there's the effect of skin elasticity. Well, that tends to reduce with time, and so you tend to have more loose skin and laxity. And then the third aspect is the effect of gravity. Everything tends to drop, and what this results in is a change in the natural shape of your face. Instead of being a more V-shaped jawline, it tends to become more square, and this gives a more tired appearance, sometimes with the presence of jowls. There are also changes in the neck, and these tend to be characterized by bands, where we tend to see the neck muscle, the platysma, that appears as two bands, really from your late 30s and 40s onwards. You start to see fullness, which is the effects of gravity in this area, and of course, loose skin. And so we can see in this lady, well, there's been some natural loss of the volume, and that results in slightly more sunken appearance in the cheeks, deeper lines going from the nose to the mouth. These are termed nasolabial lines. And then we can see along the jawline, well, there's a more square appearance of the jawline. There's the presence of jowls softening the jawline. And there's also a component of laxity and loose skin. Although many patients think, well, can I just have like a mini facelift? Can I just have a neck lift? Well, in my experience, to really give most patients the best result, unless you have very early signs, often you have to consider the face and the neck as one. By doing that, you get a better result, and you only have to undergo one procedure. Lifting the areas of the face and the neck, it's important to consider the natural anatomy, and that's where every single patient is different. Some patients are going to have more loose skin, and then the surgery should be focused on that. Some patients, well, it's going to be more the effects of gravity and the presence of jowls. And in those patients, well, a deep plane facelift that's customized to the individual's natural aging is going to give the best result. For some patients with a very full neck, well, part of that fullness is often related to like deep soft tissues, and sometimes it can be because the salivary gland in this area has dropped down beneath the jawline, and that can require, well, an advanced technique in order to lift and reshape the salivary gland and soft tissues to improve the neck. And from my experience, often patients who have that find they have a better neck than they had even in their 20s and 30s. And what are the principles of surgery that are going to improve this? Well, we want a natural rejuvenation, and that requires customizing any procedure for what the patient needs. And for some patients, that may be a mini facelift procedure. For other patients, well, it may need combined face and neck lift procedure. From my experience, deep plane facelifting tends to give patients a more natural appearance because it lifts the areas that have dropped with gravity. It's a more advanced technique, but ultimately it gives better, longer lasting results. And because less is involved in terms of the surgery, patients tend to heal slightly faster. Other considerations, well, when you consider facial aging, you really have to look at the whole picture. And some patients are going to benefit from fat transfer. Some patients, well, if you have a lot of eyelid changes, you really need to look at blepharoplasty at the same time. And then the other components of the skin. If you've had a lot of wear and tear in the skin with fine lines, pores, and wrinkles, well, often skin resurfacing can be an advantage for that. In summary, well, we've looked at the different factors that can occur with facial aging. We've talked about how those changes can be improved. I hope this information has been useful for you. Thank you for watching.